Hi everyone, welcome back to my YouTube channel and today we are going to talk about hypoglossal nerve. So let's start our topic with introduction. Hypoglossal nerve is the 12th cranial nerve and is purely motor nerve. It controls all intrinsic and most extrinsic muscles of tongue, playing a critical role in tongue movement, speech articulation, chewing and swallowing. Nuclei and origin of hypoglossal nerve. The nerve fibers originate from hypoglossal nucleus that are located in the medulla oblongata, close to the midline in the floor of fourth ventricle. The nucleus receives corticobulbar fibers from both cerebral hemispheres with contralateral dominance. Course of hypoglossal nerve. It has intracranial course when it starts when it emerges from medulla oblongata as several rootlets between the pyramids and olive. Then rootlets join and pass through the hypoglossal canal in the occipital bone. Then there is extracranial course of hypoglossal nerve. It starts when it exits from the hypoglossal canal, and then it descends between the internal carotid artery and internal jugular vein. It loops forward, passing superficial to external carotid artery and hooks around the occipital artery. It enters the floor of mouth and distributes the branches to tongue muscles. It joins fibers from cervical nerves, forming parts of ansa cervicalis, which innervates some infrahyoid muscles. Branches of hypoglossal nerve include muscular branches, meningeal branch, and cervical plexus connection. Muscular branches supply all intrinsic and most extrinsic tongue muscles. Meningeal branch gives sensitive fibers to meninges through C2 connections, and cervical plexus connection contribute fibers to ansa cervicalis. Muscles supplied by hypoglossal nerve. It supplies intrinsic muscles of tongue that include superior longitudinal muscle, inferior longitudinal muscle, transverse muscle, and vertical muscle. Their function is to alter shape of tongue by curling, flattening, or narrowing the tongue or by different movements of the tongue. Then it also supplies extrinsic muscles of tongue that include genioglossus muscle that function is to protrude tongue, hyoglossus muscle that function is to depress tongue, and styloglossus muscle that function is to elevate and retract the tongue. And then there is another muscle of the tongue that is palatoglossus, but it is not supplied by hypoglossal nerve. Instead, it is innervated by vagus nerve through pharyngeal plexus. Functional components of hypoglossal nerve. It has motor component as it is solely motor fibers for voluntary movements of tongue muscles. Functions of hypoglossal nerve. First is function is tongue movements for speech articulation. Second is manipulation of food and swallowing. Third is assist in breathing by maintaining airway patency. Central connection of hypoglossal nerve. First is corticobulbar tracts that provide upper motor neuron control, predominantly contralateral control. Then there is bilateral innervation except for genioglossus muscle which has strong contralateral cortical input. Clinical significance. First is hypoglossal nerve palsy. It may be lower motor neuron lesion. It is when tongue deviates towards the side of lesion due to unopposed genioglossus action. The tongue may demonstrate fasciculation, atrophy, and weakness on the affected side. Then hypoglossal nerve palsy may be because of upper motor neuron lesion. It is when tongue deviates away from the lesion site. It is called as contralateral weakness. In this case, there is no atrophy or fasciculation. Second significance of hypoglossal nerve is speech and swallowing difficulties. It is called as dysarthria, that is slurred speech, and dysphagia, that is difficulty swallowing, and it is due to impaired tongue control. Third significance is testing hypoglossal nerve, as we test hypoglossal nerve by asking patient to protrude tongue, and deviation indicates the lesion side. A summary of the hypoglossal nerve. It is purely motor cranial nerve. It originates from hypoglossal nucleus in medulla and exits through the hypoglossal canal. Its main function is to control tongue muscles for speech, chewing, and swallowing. Muscles supplied by this nerve are all intrinsic and extrinsic tongue muscles except for the palatoglossus. Its importance is in the tongue deviation, atrophy, and fasciculation of the tongue, and that indicate overt nerve damage. And this was all about hypoglossal nerve. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.